Molbio Diagnostics is a completely innovation-driven medical products company, making products in India and catering to the global markets. We design, develop, and manufacture high-quality healthcare solutions to meet the unmet gaps in the healthcare chain. Our mission is to ensure that we're able to reach high-quality testing right down to the lowest levels of the strata, right up to the primary level. From that point of view, we are very differentiated in the kind of technologies we design and develop. As you know, our focus area is in the area of infectious diseases, and hundreds of millions of people are dying of infectious diseases year on year. And these are completely curable diseases, but still the morbidity and mortality rates are so high, fundamentally because their diagnosis does not happen in time, and it's very delayed. So that's where we come in the picture, where we are able to now give them solutions where early diagnosis can happen right where the patient is, so that they can be diagnosed early, treated early, so that people can be cured. And at the same time, the spread of these infectious diseases can also be curtailed.
Indranil, you're raising 200 crores. Give me a sense of where you're going to use that 200 crores of fresh money.
Yeah, hi Sajid. So the 200 crores that we're raising, 105 crores will go into R&D, and as Mr. Shira mentioned, R&D is at the heart of our business. So with that 105 crores, we already have the land actually in Bangalore. So that will be utilized to build our R&D center there, which will be part of the of a fresh issue. About 72 crores will be used for automation at our plants in Goa, where we manufacture the test kits that we have for TruNat and other platforms as we go along. That automation will essentially help us streamline our operations and also help in managing our manufacturing costs more efficiently. The balance amount, Sajid, will go in for general corporate purposes.
Okay. Mr. Natarajan, give me a sense of the business model that you have now. You are making test kits and you make machines for testing of infectious diseases. How are you, are these kits given to other centers? And my understanding is that it's largely dependent on the central and state public health programs or international public programs which is there. So what is the kind of business model? How does it work for you?
No, our business model is to cater to all the healthcare requirements. So we cater to both private sector as well as the public sector. In the private sector, we work with laboratories and laboratory chains, including tier 2, tier 3 level laboratories, where our machines are being used to diagnose. At the same time, we also work with the public health system, such as the TB control program and the hepatitis control program and the HIV program and so on. So in this case, the deployment happens in the program implementation centers. In the case of TB, for example, these are primary centers, or also called as DMCs. And similarly for hepatitis and for HPV and for other parameters. And this we do not only in India, but we are global players. We are present in about 90 plus countries today. And in most of the countries, again, there's a mix of private sector and public health. But because infectious diseases are largely a public health problem, so you will see that the revenues are looking to be more from the public health side. But going forward, the R&D, as Indranil said, is our major source of growth engine. And from that point of view, new technologies are going to be launched, which will be more catering to the private sector area, such as the multiplex platforms for syndromic testing and so on. And also products which are going to be applicable for non-communicable diseases. So these are all on the anvil, and these are going to be our future growth engines also.
Just to add to what Mr. Shira mentioned, and like you rightly pointed out about the revenue mix currently, Sajid, and as he explained that, these are infectious disease wherein the larger use case is currently in the public health side, though TruNat is essentially a health infrastructure strengthening tool. We also have, our subsidiary businesses, which are into radiology and digital pathology. In terms of radiology, we have actually come up with a new product launched a couple of years back, which is a handheld ultra-portable X-ray, which is also battery operated, which can actually go to the last mile for X-ray. We have a company in the US, Optiscan, which is into digital pathology, for which we have as recently as July, received US FDA. So that is going to be a strong push for us into the digital pathology markets globally, with the US being the largest segment out of that. And for radiology, we've also received US FDA for veterinary as well as human use. And we've also received the CE approval for MDR in Europe. So therefore, this is going to be a product which will be, marketed globally. And veterinary care is a new segment which we have started. In fact, we've already started, sales of the X-ray device in India, and we're moving global as we've got these approvals, regulatory approvals. So you'll see a lot of, new products and a product mix change as we go along when we launch new products.